Hello, everyone, and welcome to the Flint Community Webinar, your community resource. I want to take a moment to remind everyone that this webinar was born out of a need for trusted, credible information, and we're so excited and thankful to all of our community partners and researchers who have helped us provide that trusted, credible information to our community members. This last month, we talked about all things in our elderly population, and we had so much wonderful information and such wonderful people that we've asked them to come back to finish the conversation. A shout out to Nicole, because I made her go to the very end, and I promised to save her real time this time to really talk about all the programs they have. We've got a really wonderful lineup for you today. We've got Nurse T and Dr. G at the Senior Center out in the community. Nicole Smith Anderson is back. Kathy Metz and Joanne Herman are back to talk about all the things we need to be thoughtful about in the road to healthy aging. So I'm going to bring our panelists and our wonderful experts here to talk a little bit more with us about our populations of people who are getting older.
Thanks. So I'm Joanne Herman with our Genesee County Health Department, and talk a little bit about our adult population and navigating aging. Let's start with physical health. Next slide. We know about nutrition and the important part that nutrition plays, and we'll talk about some resources. Kathy, I know you touched on exercise and movement and how important it is to stay physically fit, keeping our weight in control and all those type of things that really help us. But also just really thinking about as we age, some of those changes that affect us with our immune system. As we age, we know that our bodies are less effective at fighting infections, so we need to take some extra precautions. And then just medication management with our physical health and having the wherewithal to get our medications, taken appropriately, timely, and completely. So besides physical health, our mental health and wellness, we can't underestimate that. As we age, we all go through some cognitive changes with our abilities. But as I was thinking about that, I was also thinking about the importance that we have with isolation and social isolation and loneliness that occurs. And we know that that happens for a lot of different factors. As we grow older, some of us may have hearing loss, vision loss, memory loss, just trouble getting around. And then, of course, the loss of family and friends and our loved ones all contribute to that. And that makes such a difference in, the isolation, the loneliness, and leads to other mental health conditions that many times are unrecognized, undetected, and untreated. So with that in mind, we also, sounds really sad, but, and I'm in that age of population now, but there are increases in barriers that we have. With the next slide. We know about transportation challenges for those that no longer are driving or have access to a car. With retirement may come some changes in your income or fixed income. And just, which can be daunting, is changes in navigating our healthcare, especially when you have not just your primary care physician, but you have other specialists, and trying to keep track of all that can really be a challenge. Navigating that, knowing how to use the health systems, and that's why we're here today to talk about some of these resources and to help you help others how to navigate our healthcare systems. And then just the worries that you have about online privacy, security, and scams or phishing. And that may deter some of us from engaging fully that we can in technology, that fear of what's out there. As I talked about transportation, there's a resource I'm going to share with you at the end that I really didn't know about. And that's our medical liaison transport that can really help. And I'll talk about that at the very end. But what can help us? What's out there? So I listed a lot of barriers and other limitations that are there, but we do have a lot of resources. And this is what this community is about, is really helping others. So with transportation challenges, that medical liaison transport, which I learned about, is available to help not just with taking people to their appointments, their health appointments, but also if the person chooses to go into the appointment with them or wait in the lobby, they can take them afterwards to the pharmacy and the grocery store if they need that to get prescriptions filled or medications or healthy food. So they will also help with transport out of the county if needed for specialist care. So there are resources. It's just really connecting people to those resources. And our senior centers are vitally important in our community. I think we have a number of senior services that we support in our community, and they're full of activities, adventures. There's a lot of education that can occur. Meals are provided there, so there are a lot of resources that can help us with that. I think I counted we have about 16 senior services centers that our county millage supports. And I know LaTressa, Dr. Gordon, and Nurse T, you're at one of those today, and they can be very vibrant hubs for our community. We also have food services. I think last I heard there was like 1,200 meals a day are served within Genesee County for our seniors. And I think that's pretty remarkable. And so we have through G-Card, the senior food programs. And other resources like medical care, legal services, elder abuse. There's a number of resources that we can tie in, and we fund those services, so we should really tap into those. And next, I'm going to talk about immunizations. But besides what we provide at the health department and a primary care physician provides in their office, we'll go to senior centers and we'll do pop-up clinics for immunizations, and that helps us really keep our population healthier. So next slide. So vaccine preventable diseases is really important. Keeping our community healthy is really important. I talked about as we grow older, our immune system weakens, and because of that, we really need to prevent against those preventable vaccine can prevent vaccine preventable diseases, and it helps. If nothing else can help, we know that science tells us it can help reduce hospitalization and severe illness. And we're at higher risk as older adults of dying from vaccine preventable diseases. So we want to make sure that our population is covered. And I'll tell you, we are not covered. Our vaccine rate in this community, uptake rate, is not great. In fact, it's not even average, it's very subpar. So it's really important that we protect our most vulnerable population. And I know things have changed, but vaccines, what maybe wasn't covered several years ago is now covered. So most of our vaccines today are covered by Medicare and most private insurances. So we really need to take advantage of that opportunity. Next slide. So I'm going to start with talking about the kind of the seasonal, the big three. And at the top, I kind of give us our weather report right now. And so with COVID-19, flu, and RSV, those are the big three right now that are respiratory. And in our community and in our state, the information that we got from our epidemiologists would say that we're low. We're low in terms of those transmission. And it's important because this is a time right now, if you have not gotten your vaccine or your loved ones have not gotten their vaccine, to do so, to give us that extra protection that we need. So I'll start with COVID-19. And, I just heard that yesterday, only about 7.3% of us that are eligible for COVID vaccine have gotten the updated vaccine. And we know that reduces long-term risks of long COVID and hospitalization. But with that really low number, we really need to protect. And Dr. Gordon and I were talking yesterday, and we know that every single person, those one-offs really make a difference. And we really need to encourage, and as trusted sources, really tap into that resource of encouraging better COVID coverage. It's annually, but there are certain people with certain immune compromised situations that may need that more often. But with the newer vaccine that came out at the end of summer, it's really important that people get that, because the variant that is out right now, that is spreading now, this newer vaccine provides that additional protection.
Joanne, can I
So
have a question that I kind of saw? I I I know people frequently struggle to differentiate between like COVID symptoms versus flu symptoms versus RSV symptoms. And I wonder if you could like help people think a little bit about that, or when they need to think about getting screened, or why needing to be vaccinated against all three and all of that good stuff.
sure. Well, some of the treatment can be similar, as you know, but but with COVID, I'll use that as a great example. Things like Paxlovid are readily available. So if you're in that high risk population, with any of the three, you want to go back to your primary care physician as your quarterback and really work through what your symptoms are and how they can help you focus on whatever underlying disease you may have or not have, but how to optimize your health. So testing is important, and getting the right treatment plan for you and for your situation is really key. Thank you for that question. With the flu vaccine, I talked about 7.3 uptake in this area. The flu, it's only 15% right now coverage. And again, if you haven't gotten your flu vaccine, your annual, it is the time to get that now. I just looked at Genesee County this morning and we were at 12%. So um, big difference there. But either way, this is the time. And we know that 83% of flu-related deaths occur, as we're talking about the older population, are in the 65 years of age and older. So again, our rates today are low, but it's going to come at some point. So this is a great time to get that extra protection that you may need. I get a lot of questions about RSV, respiratory syncytial virus. And there's been, a little bit of confusion. There's been some changing recommendations. But we really know that if you're a healthy 75 and an older adult, you need to get the RSV vaccine for that lower respiratory tract. And if you have some weakened immune systems or some chronic medical conditions, anywhere in between the ages of 60 and 74 is recommended if you're at that high risk population. And I know there's a lot of questions. I've spoken to a lot of groups, a lot of even church groups, and that seems to be the number one question. They really don't understand why I need RSV. What does that do? How does that help? But we know that has significant impact on us. That is in our lower respiratory tract. So those are the big three, I would say, for respiratory viruses, and these contribute to most of the hospital visits that we see in this population during the peak months. Next slide. We have other important vaccines that I really want to hit on today. Shingles, the Shingrix vaccine is important. That's 50 and older. There's 2 doses. You get 1 dose now. You get 1 dose 6 months later. And we all know about shingles, and it's caused by the same virus, the same family as chickenpox that stays dormant. And if anybody's ever had shingles before, they can be a poster child for explaining all the reason why getting that shingle shot is important. A few years back, probably been about 2 years now, it wasn't covered like it is today. So people that may have went to their drugstore or talked to their primary care physician, that came with a higher price tag. And now that it's covered under Part D for Medicare coverage, it has much greater coverage financially, and you don't have that out-of-pocket expense that you had. So if that was a barrier before, please let people know that is no longer a barrier for getting the vaccine. Tdap. So in our mind, a lot of times we think, okay, I got through grade school, got through high school, got my vaccines, they're all done. I don't need to worry about it anymore. And Tdap kind of goes into that category. Like, why is that important? Why do I need Tdap? Well, there's a couple of good reasons. So Tdap stands for tetanus, diphtheria, and pertussis. And a booster is recommended every 10 years. And we got it during our childhood. There's 2 really important reasons why we need to do that. a lot of us in that age group are around younger children. We're new grandparents for the first time, and we need to protect those unvaccinated infants and children from pertussis. So that is, in my mind, with 7 grandchildren, that is key for me, is protecting our children. The other reason I would say is Genesee County. We are at a 3 times the normal rate right now, today, than we were last year for pertussis outbreak. And we are seeing it not just in Genesee County, although we're seeing it in good numbers in Genesee County, we are also seeing it at a statewide level as well. So, and pertussis is not just for young children that are, unvaccinated. As our immune system wanes as older adults, we can be more vulnerable. I know that my grandson just turned 10 a couple weeks ago, and I thought, I bet I'm due for my pertussis, my Tdap vaccine. And sure enough, when I went to the pharmacy to pick up a script, they checked and said, you're due. And I thought, yep, I am due. So it was 10 years and 1 week, and I got my update because I don't want to have pertussis, and I don't want to make any unprotected child vulnerable from that disease. Next slide. Pneumonia, pneumococcal pneumonia, the bacteria. This can cause severe infection. Sure, it can cause pneumonia, but it also can lead to other serious things such as bloodstream infection, sepsis, other very complicating factors. All adults that are 50 years and older are eligible to receive the vaccine. And I'm just going to say it's really complicated to figure it out. But if you've never had the vaccine, 50 years and older, you're eligible to receive the vaccine. As we've changed, as science is updated, we've developed different variations of the pneumococcal vaccine. And because of that, I carry a little guide in my purse that is an app, and it helps me to figure out if you've got a certain dose. We have PV20, we've got PCV21, we've got PCV15. And so I would just say, if you've gotten the pneumonia vaccine in the past, it's good to get that reevaluated to see if you are due for an updated version of that to complete your total coverage. So just to say it's complicated is a fair statement, and that's where you kind of need to have that decision-making process with your pharmacist, your nurse, or your primary care physician for sure.
And Joanne, we had one question that was, what does PCV stand for? I think it's pneumococcal vaccine, right?
It is. Yes, thank you. Yes, yeah, I'm sorry.
We're just, yes. I just try to make sure we explain the acronyms as we go along.
You're right. Thank you. Thank you for that. And there's a lot of variations on that pneumococcal vaccine. Pneumococcal is a long word for people to remember. So yes.
Very long word.
Yep. So it's important that when you go to your primary care physician, you go to your pharmacist, you are with your team, is to really evaluate where you are today. And if you thought you were caught up, it's good to, as time goes on, you may have been, but it may be like me getting my Tdap vaccine. It was time, and it was just right on the money that I got it updated. So in summary, I'd really like to say next slide, is that we really need to stay active, both physically active and active with our community. We need to take care of ourselves, eat well, get vaccinated, and have a lot of fun along the way. So I'll entertain any questions, but let me just show you the next slide. This is what is a really great resource that I wanted to share with all of you, because as all of us, on this meeting today, we are influencers, we are trusted resources, and that trusted message that we can give to the rest of our community is so important. We know that primary care physicians are essential to pass on this message, but don't underestimate the power of each of you in this room and the good that you can do to help keep our community safer, especially our most vulnerable population, our seniors. So I just want to share this additional resource with you, and I just think this is a great resource that we need to take advantage of with transportation.
Awesome.
So questions?
Yes, we do have a few. And if it's okay with you, as you talk about resources, I see we've got another one of our community resources in the awesome Dr. Aisha Harris out. And I wonder if you two will tag team some of these questions for us.
Sure.
We'll bring her up. Let's see. Let me make sure I get all of the wonderful questions because I know we've got some questions from the senior center. So one question was, what is RSV? What are the symptoms? And why are we just hearing about it now? I think that's an excellent question because I'm a family doc and usually I think about RSV and kids, right? And so I love this discussion about RSV in the context of adults and older people.
Dr. Harris, you want to take that? If not, I will.
Sure, I can start. So I think RSV, like many of the viruses, always goes through all these transformations and adaptations each year. And so, as classically as we think about it being related to children, anyone and everyone can get viruses. And if our immune system is not prepared to fight it off, then we do start developing the symptoms as far as the congestion, the coughing, the difficulty breathing. And so, unless you have a superpower immune system, technically all the viruses are opportunistic as far as infecting you. And so I think now the RSV has grown and adapted to a point where we aren't used to it as adults. We aren't able to push it off and not get sick from it. And so I think that's why we're starting to get a lot more symptoms and a lot more adults having it. People go around with viruses all the time being asymptomatic. And so I think that's what's happened over the past years as far as us not having as many adults really, really get sick. And so as the virus has changed and gotten a little bit more resistant, we aren't able to fight it off, which means that we are getting symptoms, which means we are spreading it I guess, more obviously than if we were asymptomatic. So I think that does play a big role in people not staying at home when they're sick, not taking the right precautions, not knowing that you're sick is just, it's unfortunate how many people get sick from people who don't know that they're sick. And so I think right now RSV is kind of really taking that time to infect people a little bit more aggressively because we don't have that strong immune system like we did years ago. Because viruses change. 2023 is a different virus than 2024.
I feel offended because I had RSV that my kids gave me, and I was like, I thought I was strong. I thought I had a great immune system. I'm out here like, apparently, adult me can get RSV. Y'all are laughing at me. But no, I really did. So my kids gave me RSV. And if we back up a little bit, like RSV is respiratory syncytial virus. So necessarily the symptoms we're going to get are in the respiratory system, right? So it is that exactly what you described, that sort of lots of congestion, that mucus, oftentimes that cough. In kids, it's really bad because kids like have really small airways, right? They're just so much smaller than us. And I think that's part of why in kids we get so worried about it, right? Their airways aren't big enough for them to protect themselves. That mucus in small airways can be really obstructive and it makes it like so much harder to breathe. And we don't expect that as much with adults. But I think with our adults, particularly with our people who have things like COPD or for whatever reason have obstructions in their airways already due to things like inflammation or smoking, that it really sort of creates an environment with RSV can be even a thing that we worry about with adults. In addition to the things, Dr. Harris, that you described, and that especially post-COVID, we've seen sort of viruses evolve and we've seen sort of the ecosystem or the environment that we're used to seeing viruses in kind of change. And so we're seeing these pop-ups of people get viruses that we haven't seen before. In addition to testing, right? We're testing more for things that we haven't always tested for in the past. I wonder what
I think I'll say, I guess with the testing, I feel like we used to test for flu a lot more just because people wanted to know if they were positive or negative. With the pandemic, we started testing for COVID more. And now that people have home tests, which for some are a lot cheaper than getting it somewhere else, people want to know kind of what type of virus they have. But until you go to a place that has that specific viral testing, a lot of viruses don't get claimed as far as a name. And we're like, you're sick. These are the precautions. These are the reasons to go to the hospital. Because there is no treatment. You can get the vaccine to prevent it, but once you get it, you're just supportive care. And but the world we live in post the pandemic, people want to know the name of it because they want to know if they should be just staying at home, generally resting, if they should be really isolating so that they don't be a super spreader. Like there's a whole different mindset now when it comes to viruses. But for the most part, until recently, we didn't always name the viruses because there's a bunch of them that it could be. And it doesn't always change what the course and plan and recommendations would be.
Right. And I know we have, in addition, lucky, I mean, back in my early pediatric days, our pediatric units were filled with kids with RSV and they were super sick. However, we give pregnant women the RSV vaccine towards the end of their pregnancy to protect that newborn. And then we also have medication that we can give newborns so that they are not as vulnerable in that early period. So I think we've come a long way with RSV, but I think there's lots of questions about it. And the good news that I did hear yesterday is that people are getting the RSV vaccine at a little bit higher rate if they are eligible for the vaccine. Much higher rate than they are for flu or COVID. So don't ask me why, but they are, and I'm not going to turn that down.
Joanne,
I think
you either see
people are overwhelmed and probably just like with flu and COVID. RSV are like, oh, that's new.
Yeah, go figure. I'll take any of them, any increase, any place.
Joanne must be able to see the future because one of our questions in the Q&A was literally, what can moms do to protect their babies from RSV? So thank you for nailing that on the head. The other thing that you can do, right? And we've got a pediatrician, so we might be able to bring her in on board and just see what she has to think and can talk a little bit about peds versus adults, because that's another question that we have. Also, obviously, to the extent that you're able, breastfeeding helps, right? Can transmit some of those antibodies. So being thought from that perspective, and certainly getting vaccinated while pregnant. We have a question about how RSV infection differs in pediatric patients, and is it more severe? Is it longer duration, more complicated with treatment with comorbidities? And Dale, I'm not sure if I got to your answer, but certainly, and I want my colleagues to chime in as well. Certainly, the more comorbidities you have, the more complex your immune response can be as we think about how your immune system responds to viruses, and certainly things like COPD or respiratory comorbidities can make it much harder to navigate a respiratory infection like RSV. With babies, and I'm going to let the baby doctor actually explain the answer. With babies, we worry a lot because they're just so small and their immune systems aren't developed. But I'm going to let Dr. Esch take it away about why we worry about RSV in babies.
Oh, absolutely. We definitely worry about RSV in babies. My name is Dr. Esch. I am a pediatrician in the Flint area. Thank you for having me. So first and foremost, babies under the age of 1, babies who are premature, so they were born before 37 weeks of age, of gestational age, babies who have heart conditions, lung conditions, they're the ones we worry about the most with RSV. The reason being because these babies are highest risk for having respiratory distress, so increased work of breathing. The way I describe it to parents is it looks like your baby ran a marathon when they did not run a marathon. So they're breathing very heavily, head bobbing, moving their head. They have an increased risk of getting something called bronchiolitis, which is the swelling. So picture swelling, getting bigger, getting thicker of their teeny tiny little airways. And so we really, really worry about these babies. And we do, I don't know if you guys covered the vaccination, which is actually technically not a vaccination. It's giving antibodies. So essentially giving the wonderful immune fighters to the babies. So that actually protects our teeniest, tiniest, most vulnerable babies from getting severe disease and ending up in the hospital. I work inpatient, I work at Hurley, and every winter I see so many of these babies, and small little ones get very, very sick from RSV. I hope that answered your question. Older kids, not as much, but I have seen up to the age of 5 get pretty sick. Kids with asthma can, with any type of virus, can get very, very sick from RSV. And it's just a matter of watching these babies really closely. If you know they're sick, it doesn't mean every single teeny tiny baby will come to the hospital, but you just have to watch for that very heavy breathing. And I always say parents' intuition, you know the best.
Dr. Ash, you just bought yourself an invite for next month when we get to talk about the tiny humans after having talked about the bigger humans. So thank you so much for your expertise. Always love when we bring in our community docs who are seeing and can give us the data from what they're seeing in the community. The last thing I'll say, and again, colleagues jump in, is as we think about our older humans and our older adults and what they struggle with, it's a lot of the same things Dr. Ash mentioned. If you have comorbid asthma, you have COPD, all of those things are inflammatory processes that can narrow the space that you have to breathe in. And so if you think of your airways, those little holes, you fill up these little holes and you have less space for the air to travel through the holes. And that increases your work of breathing in adults. And you see them working to breathing, not as like so much the head bobbing as often as like the other chest movements. Any other comments on RSV from my wonderful healthcare people here?
Get the
Or
vaccine.
any other questions I missed?
I'll just make a super quick comment. If that immunization had been available for my kids when they were teeny tiny babies, I 1000% would have done it. Knowing and seeing so many sick babies every year, my kids, they got their COVID and their flu, and they've aged out of the RSV. But I 1000% would have gotten it for my kids.
So I second that for mine. All right. The one person I do want to bring in is because we've talked a little bit about vaccines and testing, and I wonder if we could bring Kathy up to talk a little bit about how you might get access to that sort of testing or vaccines, particularly for our elderly population at Hurley. Oh, Kathy, you're muted.
Yep, you're right. I am.
No worries.
People kept bothering me trying yeah, so at Hurley, we do on our screening, any patient that comes to the ED or is admitted, there's a second catch for that to ask them if they're up to date. And we do run a micker on a lot of people. So we try to encourage, so you're here, would you like your shots that you need? So that is one thing that's really awesome. I'm very proud of our hospital. We do really well with that. We have a really good program built in Epic to really help us remind our nurses to ask that really critical question. So it's like a hard stop. It's hard to explain when you're using an EMR, but so we screen everybody there and it's offered. Also, then we have a lot of urgent cares that are affiliated with Hurley where seniors can stop in. And then that's one thing that our geriatric nurse specialist who runs around, she's the nurse that sees everybody 65 and older or reviews their chart. If they miss that question, she runs back and checks that too. So, and then we're involved in a lot of immunization clinic. We have a big one coming up pretty quickly where our wellness department goes out and we give turkeys and all of that away and try to get that available for all ages, but we heavily focus on seniors.
Awesome. So we did receive a question and I'm going to reword the question because I want to ask the bigger question, which is how can people know about their vaccination status?
Well, Kathy used the word MICR, and that's our registry. That's our registry at a statewide level. So ironically, if you got some of your vaccines in Florida, it's not going to show up on our statewide registry. So there are some limitations. The other limitation is the state today legislatively, you're not required after the age of 18 to enter the vaccines that are given in all these different places in the registry. Most people do, but it's not 100%. So you can check with our health department on your resources. There's a way to go online and check for yourselves. When you go to your primary care physician, your urgent care center, they can run your profile and they should run your profile for you to find out what your status is. Kroger, for example, has a program that's called Just Ask. And that happened. I kind of do a little secret shopping and I was picking up a prescription and it wasn't even for me. And they said, so are you up to date on your vaccines? And I gave them an A+ because they not only asked my name and my birth date, they looked at my profile and they recognized that well, they said I needed my second Shingrix shot. I didn't. I got them both, but they failed to record that when I just before I retired. And so I keep that off record because it's kind of like my way of testing to see if people just ask me and bring that up. So there's lots of ways to check, but I think just like Kroger says, just ask. We should all ask at our different encounters wherever we are, because there's a lot of new changes. The timelines change. What was 50 just came out for the pneumococcal vaccine. So things change. And just when you think you're up to date, you may not be. And it's hard to memorize that. So you can look at your profile and there's lots of ways to get that information.
Awesome. Thank you so much. I want to keep our experts as long as they're willing to keep answering questions for us while I go to Nurse T and Dr. G in the community and see if we have any questions that our seniors in the Senior Center have for this wonderful panel of amazing experts.
Hello.
Hi. You guys have questions? Okay, come on up. Come on up. Oh, you don't? Okay, come on up.
Anybody have a question? Come up. They were asking about comorbidities. They wanted you to break that down. What comorbidities mean? Plain English. That's what you said.
So Dr. S should be laughing right now because we've been having a conversation about how we need to do a better job of saying things in plain English, and I failed the test. And so let's fix that. So when we talk about comorbidities, those are other diagnoses that you have. Anything you've been diagnosed with, you've received a diagnosis of, that might make things a little bit harder for you related to related to the virus or thing that we're talking about. So for example, if you have asthma or COPD, those are problems that occur with the respiratory symptoms or your lungs. So you might notice that you have a little bit more trouble breathing, or you might be a smoker or something of that nature. And those are things we refer to as comorbidities, when you have multiple other medical conditions that might make it a little harder for you to deal with a new virus or a new infection.
Thank you.
But he has to give me a grade. Did I get that right? Did he?
You did. You know, and then too.
I will add that
You did really good. You did really
I will add on top of that comorbidities also reflects the things that you are not aware of. And so all because you have certain diagnoses, if you haven't been to the doctor in a while, or you haven't had a workup for something, you might have some things that will be considered comorbidities that you just haven't had defined yet as far as your medical problem list.
Yeah. And that's one of the reasons why we do a lot of education on signs, symptoms, and all of the chronic medical conditions, so that they can be able to identify them, as well as when they go to their medical physician, they'll be able to share exactly what's going on. And I know one time we was talking about navigation. One purpose of this role is to help the community residents not only navigate through their healthcare providers, but to also be able to navigate at Hurley Medical Center. So we're always available to assist them, and then piggybacking on the vaccinations. I do a lot of partnerships. One of the huge partnerships is with Michigan United. And so we focus on a lot of vaccinations in the clinic. So by me being an employer of Hurley, I know where we're low at. I knew when when our patients were coming in, the percentage of our patients that were coming in that had their vaccination shot. I know which patients are getting our pneumonia and flu, as my awesome boss mentioned, when the nurses offer the vaccination, and then some take it and some don't. But then I'm that reminder out here that's sharing why it's important for them to get vaccinated, and being that face to help them build comfortability to trust the healthcare providers, the organizations, and everything that's going on.
All right, Nursey, you hit it on the head. So one of our questions is, particularly for people who are from marginalized or underserved communities, how do we work together to ensure that proper information regarding vaccinations received and understood, and how do we work to build within communities and service providers? And you're doing it. That's how you answered the question. You're out here talking to people in the community with trusted information. But I want to hear from you and anyone else who has strategies or has thought about this. And specifically, I want to hear from Dr. Esch too, because vaccinations are often thought of as a pediatric thing. And what are you doing in your, scope to think about this question? And we didn't say this, but Dr. Esch is also like a health equity expert. So this is in her wheelhouse.
Okay. Well, for Michigan
Yes,
United.
Dr. G.
Okay, partner with the health department. Like I said, we're continually out offering access. That's one of the biggest things is access. So we're continuing to going out into those areas that have like the, social determinants of health, lack of transportation, equity and access. So main thing is being where, people are meeting people where they are, providing the vaccine clinics in the churches. We just had home visits wherever we can, and then just getting the messages out there and answering questions, being transparent, and like I say, always creating that safe space as we normally do for answering all questions. We just had a good conversation here earlier about COVID and still where COVID, it originated from. So we know we say we can't really say that, but we do know we have a vaccination that's not, will not prevent it, but it'll make it take it from wild to mile. And so we just keep educating out here in the community about what vaccinations really do and the equity of it. And the we had one question out here too. I don't know if she ran away. Sorry, we talked too long. She ran away.
No.
Yeah, but no. Okay, come on.
All right, tell them who you are.
Tell me
What's your name?
My name is Gloria Robinson, and I have a concern with people carrying the virus, but yet they don't have it, the COVID. And what they call that, when you carrying it, they are carrier. But is it something that we can do? It's not helping us as people walking around carrying it. And we don't know it, and they sitting right by, and they be saying, "Oh, ain't nothing wrong with me," but then if nothing wrong with them, then they really putting it on other people, and other people don't even know who to say they done got it.
You are 100%.
How can you blame somebody for getting you something, and when everybody's saying, "I'm well"?
Miss Gloria, that is a wonderful question. So you're asking about asymptomatic carriers, people who don't know that they have
The
COVID.
asymptomatic and plus the people that don't know that they really sick.
Right.
They're going around and they not being vaccinated, and they're going around giving it to people talking about, "I ain't sick, I ain't got no symptoms."
100%. We all know that person, right? We all know somebody who has done that.
Yeah.
So you have to take care of yourself. You have to take care of yourself, and you need to get protected with the vaccine. You need to wash your hands. If somebody, you hear them in the room is coughing, you need to stay away from them or put a mask on.
You can see people do that, but still, if they swaying up and down, ain't nothing wrong with me.
Mhm.
I don't have that. I don't be doing all that. But then you around them.
Yeah. And
So-
then I think a lot of that is tied to health literacy.
Mhm.
A lot of people don't know when they're sick. So most common, what we discover out here, if you ask people how they feel, they say, "I feel fine." Do you need to go to the hospital? No. Do you need to go to your provider? No. So a lot of it is just associated with the health literacy knowledge. But the more we educate and the more we talk to people and create safe spaces for them to be transparent and to say that they don't feel well. Because when you say that you don't feel well, so like now, America is afraid to cough. When in actuality, coughing is actually good, but it's just that we're just so afraid that so many diseases or viruses are transmitted through droplets. But it's like now America is so afraid. So a lot of times people are just afraid. So just seeing beyond what they're saying, but being able to ask them questions. Okay, you're telling me you feel well, but do you know the signs and symptoms of this? Are you experiencing any of these signs and symptoms? Let me share these risk factors for you. It's not only important for you to protect others, but it's also important for you to protect yourself.
I 100% agree with that. Oh, sorry.
No,
I
you're
just
fine.
wanted to,
Say shout out to Dr. G and Nurse T, because actually in the community, we get to see you doing this work, and it's just amazing and really wonderful work to see you like in the community being this sort of trusted information and working to make sure people have that understanding that they need. So shout out to the work you do. I'm sorry, go ahead, Dr. Ash.
oh, no, that's okay. Definitely shout out to you guys. I totally agree with that and with what Joanne said. As a pediatrician, viruses are pretty much my life in the winter months. I think number one, first and foremost, you protect yourself. You get away from a person if your spidey senses are tingling and you think that someone is sicker than they say they are, you walk away. You get away from them and you say, I don't believe you, and I'm walking away. You can wear a mask to protect yourself if you want. You can wash your hands, like you can even educate someone else, like, hey, you're coughing. I said this to one of my residents the other day. Can you please cough in your arm? It's okay to tell other people to do that. Especially if you feel like it's protecting you and your own health. I think you have to prioritize yourself and the people around you. There might be a teeny tiny baby around you. You never know. And then I would say I totally agree with teaching other people. I think that's part of our job, is to make sure people know people are asymptomatic carriers, but also sometimes you can have a virus and not have symptoms and still be someone that can transmit, and then you develop symptoms. So there's this lag period where you can get a virus from someone else, be symptomatic, not have symptoms, and then 2 days later you start coughing and sneezing and having a fever. So I think no matter what, if you've been around teaching people, if you've been around someone sick, be extra careful around the elderly and the young, and make sure that you first and foremost protect yourself.
This was wonderful. I want to give all of the people on the screen a final word, because this has been just magical. I really appreciate all the wonderful expertise we've got. So I'll go to Nurse T and Dr. G first in terms of last word or question from your community over there.
So I'll go first. I just want to. So I just want to share something that I think is very important that I'm going to really start educating on in the community. I know we focus on COVID, RSV, and the flu. Well, about 3 weeks ago, I didn't feel well. Automatically, I thought I had COVID, I thought I had strep throat, and I thought I had influenza. Guess what? I was negative for all three, but I felt like a truck had hit me. I'm still pressing and I'm still pushing, and I didn't feel well. So the one thing that's concerning me now is that as a healthcare worker, I knew after about 5 or 6 days, if there was no improvement, that I need to follow up with my physician. Followed up with my physician and I was able to encourage or recommend that I get a chest X-ray. Well, ended up had walk-in pneumonia. So walk-in pneumonia is mimicking the flu symptoms, it's mimicking COVID, it's mimicking everything. So one thing I really want to stress to the community is don't take pneumonia lightly. And what's even more amazing, I was supposed to take my flu shot like a week before and ended up couldn't take my flu shot or my pneumonia shot because I got sick. Now I'm feeling better, so I'll definitely go get it. But the thing about it is knowing that there's when to follow up and go to that next step. Because like you guys mentioned, there's supportive care and supportive treatment. So had I been a person that didn't know, I could have been at home thinking that I was going to get better and prolonged going to see the physician. So what I say to everybody out there, if you're testing negative for any of the big three and you're not getting any resolve, you're not getting better, do not hesitate to follow up with your physician so that they can go to that next step.
That is
I got one community question. I'm gonna take the computer to her because she keeps coming back and forth. So, okay, man, what is your question?
So I'm going way back when this came out.
Okay.
So we were talking about resources for seniors, for things that they need. And there's lots of resources from what I'm hearing, and rides and getting to here and getting to there. There's one resource that I would really like to see for seniors, and that's snow removal. How many people get snow removal or can have that assistance? I live alone. I'm by myself. I'll be 50, 70 in 2 months. So it'd be nice if they had some snow assistance for the seniors. That's
So
really, really needed.
This
there,
is
there is a
perfect.
program. There is a program for snow removal that's covered under our senior millage. I just checked yesterday, and it's pretty tapped out, that resource right now. It was on a
It
first
hasn't
come.
even started. It hasn't even started.
Yeah, I know. Well, I mean, tapped out in terms of how many more applicants they can take, but I will keep my pulse on that as soon as, and I will share that with the seniors team at the county, and make sure that we get that information to Dr. Gordon and Nurse T when that does open up, so that you're an early adopter when that's available again.
That
But
would be
that
nice.
has been recognized as a need for sure.
Okay, that would really be nice because I live on a major street called Water Road. So every year the snow plows come down and push all the snow up into my driveway. Up to the point that it's almost to my waist plenty of times. So it would be nice to have that resource available.
Yeah.
All right, thank you.
Thank you.
Does anyone else have any questions?
That was a wonderful question, and you've given us some homework. So we'll come to the next webinar with some answers to how we get snow removal. And it's a perfect segue to Nicole Smith Anderson, who I have again only given limited time. And so hopefully you have enough time, Nicole.
Don't you worry about me. We got plenty of stuff. So if you want to head to the next slide. So what was really perfect about today is Joanne started our conversation talking about the importance of things like physical activity and healthy eating as we age. And there are some great resources available that I just wanted to make sure people were aware of in that realm. So we have a couple programs that are available. These programs are free for any resident in the community. So one of the classes is called the Learning Kitchen, and it really helps to focus on helping participants plan and prepare nutritious, low-cost meals and snacks for themselves and their families. The class itself is about 6 weeks long, and this fall we have 4 locations scheduled. So one class at Urban Renaissance Center, one class at Oak Street Health, the North Clinic, one class at Insight Health and Fitness, and then also a class at Swartz Creek Senior Center. So we try to diversify and get as many places as we can in the community as well. Another program that we have is called Fork in the Road, which I think is a very cute title. And again, that's another hands-on program. It's a little more education in it as well, but that is designed to really focus on promoting those healthy behaviors to help reduce chronic disease burden and promote healthy aging, right? So making sure we're eating healthy, making sure we're moving. That class is also 6 weeks, and we have 2 scheduled for this fall as well, one at Grand Blanc Senior Center, and then one at Oak Street Health Clinic South. So again, great opportunities. These are free programs that are available to directly support nutrition education. If we go to the next slide, we also want to promote that physical activity. So we have a really cool program called Rec Connect, and that is a chair exercise program that really just encourages everyone to be physically active. And what's fun about it is every single week you're doing a different type of activity. So if you're new to exercise and you just want to kind of figure out what you like to do, this is a great chance to do that, because every week you're trying a different activity. So maybe it's strength training, maybe you're trying yoga one week. It's going to give you a good range of what is out there, and then perhaps help you decide what you like to do the most to encourage that physical activity overall. That class is also 6 weeks. We have one scheduled for Hasselbring Senior Center, and then also Burton Senior Center. And then finally, our last free class that we have for the fall is, we're very excited to have this back, is our Cooking with Kids program. And so this is a free program that we actually host at the Children's Museum. It's a great way to engage if you have kids in your life, whether they're your grandchildren, your nieces, your own kids. We certainly encourage you to join the class. We have a session going on right now. I believe it is full, but if you call 810-232-2228, they will be able to get you signed up for the next series that I know we're going to start doing in the next year. So really, all in all, I think it's important to know that there are resources available. We have lots of education opportunities. They are free. If you are at a location that has interest in perhaps hosting one of these classes, you can always reach out to the number on the screen, and they can definitely help kind of put you in the queue to have some of these activities held at your facility. So that is it. We still have 6 minutes, EJ, so that is good news. But happy to answer any questions, but we're really excited about the opportunity to make these resources available.
Oh, you're always amazing. Hey, I had a question about you. It's coming up on the community health needs assessment time, right?
Yeah, we're
Tell us a
back.
little bit about that.
Yeah, so community health needs assessment is something that we do every 3 years in collaboration with the local hospitals. So Genesis, Hurley, and McLaren, as well as the local health department. And this is really the opportunity for us to identify what our community thinks is happening, right? What their needs are health-wise, what are our areas for opportunity and improvement. So our community health needs assessment resident survey is underway. I can make sure that we have the link available at some point. But we encourage everyone to complete it. And this isn't just the Flint survey. This is Genesee County wide. So we know that, perhaps your experience in a more rural area is different than somebody's in the cities, but we want to make sure that we're obtaining that feedback. It really, oh, thank you, Heatherlyn. It really helps the hospitals in particular kind of design their plans to see what they need to do or see what other priorities they need to have within the community. So we're definitely encouraging folks to complete that survey. It will remain open through the end of the month at least. So we certainly appreciate anyone who takes the time to complete it. It doesn't take more than 10-15 minutes, but your feedback is so important and really critical to how we do the entire process. So thank you for that reminder, EJ.
Yeah, I want to, like, with our last couple minutes, I wonder if we talk a little bit about like what type of data is in the community health needs assessment and why is it useful and who uses it. We have community members here and we've got, our senior center here. And in the spirit of making things like understandable in plain language, right? So why would we do it? Why is it important?
So it's important for a couple of reasons. I think one of the most important reasons is you have 3 hospitals within your community that have a lot of interest in putting programming in, prioritizing initiatives that are meaningful to the community. If you don't provide them with feedback about what's meaningful, they're just going to pick what they want to choose. And that's the reality, right? So being able to provide that feedback is really important because that helps the hospitals to really design interventions to, perhaps put additional dollars behind certain things that are a big priority. A good example of that would be maternal and child health, right? So if that's something that kind of rises to the top, then hospitals may prioritize that and kind of program accordingly. And so that's really a critical component. When we talk about the actual beautiful, gigantic community health needs assessment document we create, there's all the data in there because it's pretty comprehensive. And the way that gets utilized, I hear most often is I hear from residents and CBOs that say, oh my gosh, this is perfect. I used this and I wrote a grant to try to get more dollars for X, Y, or Z. And so we really do think of this as it's a community publication. I think Heatherlyn just dropped a link, but if you've ever used the CHNA, know that it's really important that we get feedback from the residents. What I will say is, having been involved in a couple processes, the data almost 100% aligns with what the community says. So that's something that I always get really excited about. So when you see the top priorities of the community, the data itself usually reflects that almost perfectly, which I'm always really excited about. So, knowing that their feedback is, perfect.
Right. No, that makes a lot of sense. So when we talk about the types of grants that community organizations might apply for, that allows us to have funding to do things like have snow removal for our people who aren't getting access to it, or expand those resources that might not be available to our senior populations and our people who need it.
Yeah, absolutely.
Awesome. Nicole, always appreciate you. Thank you so much for your wonderful expertise. I have a ton of thank yous. I want to say thank you to Nurse T and Dr. G and all of the community members at the Senior Center. Thank you for your wonderful questions, and we'll be sure to come back with that important data. Thank you to Dr. Harris and Dr. Esch for being here and their wonderful expertise. Thank you to Joanne Herman and Kathy for their wonderful expertise. We really can't have this webinar without the trusted, wonderful messaging and expertise of the people who are here, and without the support of the community. So we thank you so much for your engagement and your questions and your thoughtfulness. Community education units for community health workers are here, and we will see you next month with an answer to the snow removal question and to talk about the younger population.
Thank you all so much.